Guys, what if I told you that millions of men over 60 are throwing away hundreds of dollars every single month on performance pills, injections, and expensive clinical treatments, while the real solution has been sitting in their bathroom drawer this whole time? Something probably worth about 50 bucks. Something you walked right past this morning without giving it a second thought. It's designed to vibrate. It's designed for precision, and it creates the exact frequency needed to reactivate nerve pathways that control erections. But 99% of men have absolutely no idea. I'm talking about something you already own, something that has been meticulously engineered for years to deliver consistent, controlled vibration. Medical device companies charge thousands of dollars for professional-grade vibration therapy equipment. Insurance doesn't cover most of it, and the waiting lists to get access to these machines in clinical settings can be months long. But here's the truth that nobody in the industry wants you to know. You've had essentially the same technology sitting in your bathroom this entire time. Unused, overlooked, ignored. I'm Dr. Jocelyn. I've spent over 14 years working in men's health, specializing in age-related sexual dysfunction and pelvic neurology. I've worked with thousands of patients, published research on nerve pathway restoration, and I've dedicated my career to finding solutions that are accessible, affordable, and genuinely effective. And I can tell you with complete confidence, when I first realized that men were spending absolute fortunes on expensive treatments, traveling across state lines to visit specialized clinics, maxing out credit cards on prescriptions that only work temporarily, and feeling increasingly hopeless about their situation, all while ignoring this simple device they already owned, I felt a genuine sense of urgency. I knew I had a responsibility to share this with as many men as possible. Not next month, not behind a paywall, right now, for free. The technique I'm about to teach you takes 30 seconds. It costs you nothing extra. And it works because the vast majority of men have never truly understood the medical potential of the everyday devices sitting in their own homes. They've been searching desperately for complex, expensive solutions when a simple, science-backed approach was right under their nose the entire time. I want to be completely transparent with you about something before we continue. I'm not here to sell you anything. I don't have a product line. I don't have a supplement brand. I'm a physician who believes that the best medicine is education. When you understand how your body works, you gain the power to heal it. And that's what today's video is all about, giving you knowledge that empowers you to take control of your own health. Now, before we go any further, I want to take a moment to connect with you. We haven't checked in a long time about who's watching and from where. So please, let me know in the comments. Tell me your city, your country, your story. Seeing your support from all around the world genuinely motivates me to keep making these videos and keep fighting for men's health. It reminds me why I do what I do. And while you're down there, hit that subscribe button so you don't miss this technique and all the ones I have coming next. I promise you, what I'm building on this channel is going to change lives. All right, let's begin. So, what exactly is this device, and why is it so remarkably powerful for erectile function? Your electric razor. That's what we're talking about. Your standard electric razor creates vibrations at approximately 7,000 to 10,000 vibrations per minute. Now that might sound like just a number, but let me put it in context for you. This isn't random buzzing. This isn't haphazard noise. This is precisely engineered oscillation, consistent, controlled mechanical vibration at a frequency that happens to fall within the optimal range for nerve pathway activation. Let me say that again because I want it to sink in. The vibration frequency that your electric razor produces naturally falls within the therapeutic range that medical researchers have identified as optimal for stimulating dormant nerve pathways. This isn't a coincidence, it's physics. And when you understand how to harness it, the results can be truly remarkable. Now, the pressure point I'm about to show you is a specific anatomical location called the perineum. It's the area between your testicles and your anus. Most men ignore this spot completely. They don't know it exists, they don't understand its significance, and they've certainly never thought of it as a gateway to improved erectile function. But what lies beneath that small patch of skin is extraordinary. Let me walk you through the anatomy so you understand exactly why this spot matters so much. Right beneath the perineum lies your bulbospongiosus muscle. Now, this muscle plays a critical role that most men never learn about. It's the muscle that traps blood inside your penis during an erection. When this muscle contracts, it compresses the base of the erectile tissue, preventing blood from flowing back out. Without this muscle functioning properly, achieving and maintaining firmness becomes extremely difficult, no matter how much blood flow you generate. Also sitting beneath this point is the pudendal nerve, one of the most important nerves in the entire male sexual response system. This nerve carries electrical signals between your brain and your erectile tissue. It's the communication highway. It's the fiber optic cable that transmits the message from your brain saying, "Become aroused," down to the tissue that needs to respond. Here's what happens as men age, particularly after 60. This entire area gradually becomes dormant. It's a slow, silent process that most men never even notice until it's already significantly progressed. The bulbospongiosus muscle weakens from disuse. Just like any other muscle in your body, if you don't stimulate it, it atrophies. The pudendal nerve's signal strength diminishes year after year. Nerve conduction velocity slows down. The electrical impulses that once traveled like lightning now move like a sluggish current through an old wire. Blood flow to the pelvic region decreases as arteries lose their elasticity and microcirculation diminishes. Morning erections fade, first becoming less firm, then less frequent, then disappearing altogether. Spontaneous arousal becomes rare, and slowly, gradually, men start to believe, incorrectly, that their body has simply shut down permanently, that this part of their life is over. I've sat across from hundreds of men who've told me exactly that. "Dr. Jocelyn, I think it's just over for me." And every single time, I look them in the eye and say the same thing. It hasn't shut down, gentlemen. It's gone to sleep. The structures are still there. The nerve is still intact. The muscle still exists. The blood vessels haven't disappeared. Everything your body needs to produce a firm, reliable erection is still present inside you. It's just dormant, waiting. And what I'm about to teach you is exactly how to wake it up. When you apply targeted vibration at the right frequency to this exact spot, you can reactivate these dormant pathways. The vibration stimulates the pudendal nerve directly, increases circulation to the bulbospongiosus muscle, and essentially sends a wake-up signal through your entire erectile system. It's like jump-starting a car battery that's been sitting in the garage all winter. The battery isn't dead, it just needs a spark. Now here's the technique, and I need you to listen very carefully because getting the position, the pressure, and the timing exactly right makes all the difference between this working beautifully and this doing nothing at all. I've refined this protocol over years of clinical practice, and every detail matters. First, you need privacy and comfort. This works best when your body is in a relaxed state, not tense, not rushed, not anxious. Your nervous system needs to be in a calm, parasympathetic state for the vibration to have its maximum effect. If you're stressed and your body is in fight or flight mode, the blood vessels in your pelvic region are already constricted, and the stimulation won't penetrate as effectively. So find a private space where you won't be interrupted. Either sit on the edge of your bed with your feet flat on the floor and your back straight, or stand comfortably with a slight bend in your knees. Take 3 to 5 slow, deep breaths before you begin. Inhale for 4 counts, exhale for 4 counts. Let your shoulders drop, let your jaw relax. This small preparation step significantly improves the effectiveness of the technique. Take your electric razor, make sure it's clean. I cannot stress this enough. Hygiene is non-negotiable when you're working near sensitive areas. Wipe the device down thoroughly with an antibacterial wipe or warm soapy water. Ideally, designate a specific razor solely for this purpose. Keep it separate from your grooming razor, stored in a clean, dry place. Then, turn it on. You want full vibration power for this technique. Not the gentle setting, not the trimming mode, not the travel-friendly quiet mode. Full power. You need the complete vibration frequency, that 7,000 to 10,000 vibrations per minute range, to effectively reach the underlying nerve structures through the layers of tissue. Now, locate your perineum. Here's how to find it precisely, step by step. Place one finger halfway between your testicles and your anus. Feel for a slight depression in the tissue, a small, subtle dip or softness. That indentation is sitting directly above the pudendal nerve and the bulbospongiosus muscle. That's your target zone. Take a moment to familiarize yourself with it. Press gently. You might feel a faint, deep sensation, almost like a mild pulse. That tells you you're in exactly the right place. Knowing precisely where this spot is makes the entire difference between this technique transforming your life and this technique doing nothing at all. Here comes the key part, and please pay very close attention to every word. You are going to apply the back or the side of your electric razor to this spot, not the cutting head. I repeat, never the cutting head. Use the smooth back portion of the device or the flat side of the casing. The vibration transfers beautifully through the solid casing material, and you get all the therapeutic benefit without any risk of irritation, cuts, or injury to this sensitive area. Apply gentle but firm pressure. Think of it as the pressure you'd use to press a doorbell. Deliberate, steady, but not forceful. You want to feel the vibration penetrating into the deeper tissue layers, reaching beyond the surface skin down to where the nerve and muscle structures actually sit. But this should never be painful. If it hurts, you're pressing too hard. Ease up slightly. You want steady, consistent, comfortable pressure with the full vibration frequency transmitting deep into the tissue. Hold this position for exactly 30 seconds. I strongly recommend using a timer on your phone the first several times you do this. The vibration needs this full duration to effectively stimulate the nerve pathways and generate a meaningful physiological response. Don't rush it. Don't cut it short at 15 or 20 seconds because you feel impatient or think, close enough is good enough. The full 30 seconds matters. The nerve requires sustained input to fully activate. During these 30 seconds, you may notice several things happening in your body. A tingling sensation spreading through your pelvic floor, almost like a gentle electrical hum. A warmth radiating outward from the contact point as blood flow increases to the area. Perhaps even a slight pulsing feeling deep in your pelvic region, rhythmic and steady. Some men describe a subtle heaviness or fullness developing in the genital area. All of this is completely normal and expected. In fact, these sensations are a very positive sign. They mean the vibration is reaching the right structures. They mean the pudendal nerve is responding to the stimulation. They mean the system is waking up. If you don't feel much the first time, don't worry. Sensitivity increases with consistent daily practice. After 30 seconds, turn off the razor and remove it gently. Take a slow, deep breath. Many men report feeling more awake, more aware, more activated in that entire pelvic region immediately afterward. Some describe it as a subtle aliveness, a warmth, an awareness that simply wasn't there before. That sensation is your pudendal nerve coming back online. That's your body responding. That's the beginning of reactivation. That's it. 30 seconds of targeted vibration therapy using a device you already own. No appointment needed. No prescription required. No side effects. No cost. Now let me explain what's happening biologically during those 30 seconds, because I think understanding the science will help you trust the process and stick with it. The vibration is stimulating specialized nerve endings in your perineum called mechanoreceptors. These are sophisticated sensory structures that respond specifically to mechanical pressure and vibration. They are exquisitely sensitive to the frequency range that your electric razor produces. When these mechanoreceptors activate, they send rapid electrical signals along the pudendal nerve pathway. These signals travel directly to your spinal cord and upward to your brain. Your brain interprets these signals and responds by triggering a cascade of physiological changes. Increased blood flow to the pelvic region, activation of the bulbospongiosus muscle, and enhanced nerve sensitivity throughout the entire erectile system. Your bulbospongiosus muscle receives better circulation. Dormant nerve fibers begin conducting signals again. The entire erectile mechanism gets a wake-up call that it may not have received in months or even years. It's like turning the lights back on in a house that's been dark for a long time. Room by room, system by system, everything starts functioning again. I often explain it to my patients this way. Imagine you have a garden path that hasn't been walked on in years. Weeds have grown over it, leaves have covered it. You can barely see it anymore. But the path is still there, underneath all that overgrowth. When you start walking on it again, day after day, the weeds get pushed aside. The surface becomes visible. The path becomes clear and easy to follow. That's exactly what's happening to your nerve pathways when you apply this daily vibration therapy. You're clearing the path. You're restoring the connection. You're making it easier for signals to travel where they need to go. Additionally, the vibration helps reduce chronic muscle tension in your pelvic floor. This is something I see constantly in my practice, and it's far more common than most men realize. Men who sit for long periods, office workers, long-distance drivers, retirees who spend hours in recliners or at desks, develop chronic pelvic floor tension without even knowing it. This tension acts like a vice grip on your blood vessels and nerve pathways. It's like someone stepping on a garden hose. The water, in this case blood and nerve signals, is still there, but it can't get through. The targeted vibration helps release this accumulated tension, allowing blood and nerve signals to flow freely and naturally again. Now, I want to give you realistic, honest expectations because I believe in being completely straightforward with my patients and with you. I'm not going to promise you overnight miracles. That's not how the body works, and anyone who tells you otherwise is trying to sell you something. What I will tell you is that results build gradually, consistently, and meaningfully. And here's the timeline that most of my patients experience when they follow this protocol faithfully. In the first 24 to 48 hours, you'll notice increased awareness in your pelvic region. Slight tingling, gentle warmth, a sense of aliveness and connection that wasn't there before. This is the very first sign that your nerve pathways are beginning to respond to the stimulation. It's subtle, but it's real, and it's important. Pay attention to it. Acknowledge it. It means something is happening. Days 3 to 5, morning erections often start returning. They may not be at full hardness yet, and that's perfectly okay. Don't judge yourself. Even partial firmness upon waking is a powerful, meaningful indicator that your erectile system is beginning to reactivate. Your body is remembering what it's supposed to do. The signals are getting through. The pathway is clearing. Weeks 1 to 2, morning erections become more consistent and noticeably firmer. You may also start to notice faster arousal during intimate moments. Your body responds more readily, more naturally. Your blood flow is genuinely improving. Your nerve sensitivity is increasing. The entire system is rebuilding itself day by day, session by session. Weeks 3 to 4. This is where most men report significant, meaningful, life-changing improvements. Fuller morning erections that feel like they did years ago. Better performance and stamina during intimacy. Increased confidence that radiates into every area of their lives. A renewed sense of masculinity and vitality that they thought was gone forever. The daily stimulation has effectively retrained your erectile system. You've rebuilt the neural pathways, improved the blood flow, strengthened the muscle, and restored the communication between your brain and your body. But I need to be completely honest with you about something. Consistency is absolutely crucial. Without it, none of this works. Your nerve pathways need daily activation to maintain optimal function. This is not a one-time fix. It's a daily practice. Think of it like exercise. You wouldn't go to the gym once and expect to be fit for the rest of your life. Your pelvic health works the same way. Do this once every single day, preferably at the same time each day. Morning works wonderfully for most men as part of their regular grooming routine. It takes 30 seconds. That's less time than it takes to brush your teeth. Now, let me address the mistakes that I see men make most often, because I want you to avoid every single one of them. The first mistake is inconsistent practice. A man tries it for 3 days, feels encouraged, then skips 4 days because he gets busy. He tries it once more the following week, doesn't see the dramatic results he expected, and quits entirely. But nerve reactivation requires consistent daily input. Missing days doesn't just pause your progress, it resets it. Your nerve pathways need that daily signal to keep building their response. The second mistake is expecting instant, dramatic results after a single session. I understand the desire for immediate gratification, but remember, you're retraining nerve pathways that may have been dormant for years. That kind of neurological rebuilding takes time, patience, and trust in the process. The men who succeed are the ones who commit to the full timeline without constantly checking for results every hour. The third mistake is using incorrect pressure or positioning. Too light and the vibration doesn't penetrate deep enough to reach the nerve structures. Too hard and you cause discomfort that actually triggers tension rather than relaxation. Finding that sweet spot, firm but comfortable, is essential. Take the first few days to experiment and find what feels right for your body. So here's my challenge to you, gentlemen, and I mean this sincerely. Use this technique every single day for 14 days. Just 14 days. That's all I'm asking. 30 seconds each day. Same time, same technique, same commitment. Days 1 through 3, focus on getting comfortable with the technique. Learn the exact positioning. Find the right pressure. Develop your routine. Days 4 through 7, start paying attention to changes. Increased pelvic awareness. Possibly some morning firmness. Subtle but real shifts in how your body responds. Days 8 through 14, evaluate your progress honestly. Most men see clear, undeniable improvements by day 14, and many of them wish they had started sooner. If this technique helped you understand how simple, everyday tools can create powerful results when used with the right knowledge, hit that like button and subscribe to this channel. And drop a comment with 3 words. I'm trying this. I read every single comment, and I want to see who's committed to giving this a real, honest 14-day test. I'm Dr. Jocelyn, and I want you to hear me when I say this. Your erectile function isn't gone. It hasn't disappeared. It hasn't abandoned you. It's just been waiting quietly, patiently, for the right kind of activation. The pathways are still there, the nerves are still there, the muscle is still there. Your body still knows what to do. It has decades of memory built into its systems. It just needs you to wake it up. I've watched men in their 60s, their 70s, even their early 80s reclaim something they genuinely believed was lost forever. I've seen marriages reignited. I've seen confidence restored. I've seen men walk into my office with defeated eyes and walk out standing taller, smiling, full of hope. That transformation never gets old for me. It's the reason I became a doctor. It's the reason I'm here, talking to you right now. You are not too old. You are not broken. You are not past the point of no return. Your body is remarkably resilient, remarkably capable of healing and reactivating if you give it the right stimulus. 30 seconds a day, a device you already own. That's all it takes to start reactivating what's been dormant and reclaiming a part of your life that you thought was lost forever. Thank you so much for watching. Take care of yourselves, gentlemen. Prioritize your health, be patient with the process, trust your body, and remember, the solution might be far simpler than you ever imagined. I'll see you in the next one.